Hi, everyone. I'm delighted to be here today with Dr. Dan Renouf, who heads pancreatic cancer at BC Cancer Agency. This coming Sunday, I'll be racing up Cypress Challenge, which happens to be on Mount Seymour this week, to raise money for pancreatic research and treatment. 100% of funds go towards this amazing cause, and Dan and his team lead this. Dan, so good to see you again. For the last 2 years, I've been interviewing you and you've been promising that there's going to be some excitement in pancreatic cancer. We all know for the last 20 years, the field was more or less unchanged. Something exciting happened this year, and I think you knew this is coming. Maybe you can talk a little bit about it and how you're involved with it, and what's more to come.
Thanks, Ali. Yeah, this has been a really exciting last few months in the field of pancreatic cancer research and new therapeutics. We've known for some time that pancreatic cancer, one of the reasons that makes it such a difficult cancer to treat is that it's driven by something called the RAS pathway. And that's been for many years considered quote unquote undruggable. And one of the areas of excitement that we spoke about last year was that there are now drugs being developed that appear to be effective in targeting RAS mutations. And just a couple months ago at our international meeting, we heard the results of the first of these trials. I think you have a slide to pull up, Ali, and I can speak to it, which demonstrated really remarkable benefit from this type of treatment. So this first RAS inhibitor is a drug called daraxonrasib, which targets the switched on version of RAS. It's a targeted therapy. And in this clinical trial, patients who had advanced pancreatic cancer who had already progressed on chemotherapy were randomized to either receive this drug or standard of care second line chemotherapy. And what these graphs show and what the presentation described was that um, in this setting, treatment with this new therapy doubled survival compared to what we see with standard chemotherapy. So, really remarkable benefit. I think, unfortunately, it's still survivals in just over a year in this setting. So, it clearly shows that we've made progress, but there's a huge amount of steps needed to move forward. I compare kind of the situation we're in pancreatic cancer right now to where things were at with melanoma 4 or 5 years ago, where that was a different cancer that was thought to be untreatable. There was some progress with targeted therapy initially, and now really transformative changes with immunotherapy and other approaches. And I think one of the really exciting things that is coming out from this in pancreatic cancer is a huge amount of momentum and excitement in the field of drug development in pancreatic cancer to say, look, we've had one success, let's build on that, let's get other successes. So we've really moved away from this being kind of a hopeless cancer, an area where it's been very hard to get engagement, to a point where there's a huge amount of interest from the drug development and research sphere in terms of how we can further build on this initial success. So really, really exciting time, and really a vital time to continue to build up our research programs locally, nationally, and internationally. So really excited to see everyone on Seymour and excited to do the ride this year. And it's going to be great. Thanks, Ali.
Dan, this just a quick question. How are you involved with this program, Revolution Medicine?
Yeah, so this specific trial that was presented was not open in Canada, but building on this success, there are several other clinical trials in different settings, including in patients with newly diagnosed advanced pancreatic cancer that will be opening in at BC Cancer. And again, another reason for excitement is that there are many other RAS-targeted therapies in development, and we have clinical trials of those as well open. So a lot of involvement in this specific therapy as well as similar therapies here at BC Cancer.
That's so exciting. Dan, I love the work you're doing. I'm so excited our dream and vision of, hopefully treating these patients better and eventually curing it is coming true. Excited for the work that Revolution Medicine has done. But as you said, we need more novel targets, better diagnosis, earlier diagnosis, and more effective treatments. And with the support that we can get from the community, hopefully supporting the Cypress Challenge and the work you're doing with your colleagues, I'm hoping we can bring an end to pancreatic cancer. Thanks for your great work. Best to you, and hope to see you on Sunday.
We'll see you there, Ali. Thanks a lot.
Take care. Bye.